I've introduced myself. Many of you already know me. I'm Steven Greenman. I want to welcome you here on behalf of my entire dental team. We really enjoy performing this service, okay? And why? Because it's different than doing fillings and crowns and bridge work and dentures, because dental implants have the capacity to really change a person's life. And oftentimes it's instant. And that feeling that a person has when their whole life has been changed for the better is just the best feeling in the world for me and my team. We'll show you some before and after pictures of people who have, whose lives we have changed, that did have that kind of transformation, and we've witnessed this time and time again. So, we know that this does work. First of all, to talk about our team, between us, we probably are getting close to 100 years of experience. Lisa Battaglia is an ace surgical nurse. She also is our practice administrator. She's been with me now, it's going on 8 years. Comes from a background in implantology, really is a vital part of our practice. And when you call on the phone, typically, she's going to be the person that is going to answer. Bethany's been with me now for getting close to 20 years. Bethany, again, is an RDA. She's my primary dental assistant for the restorative parts of our dental implant procedures and also for our other routine dental procedures as well. She is just a wonderful person. She's as warm as can be. You can always call and get her on the phone to talk about your treatment or any other concerns that you might have. So between Bethany and Lisa, they comprise the main dental implant team with me, and I really couldn't do it without them. There's just no way. Kara Headland is our hygienist. Kara has been with me a full 20 years as of last summer. We hired her when she was a baby. Kara is our crackerjack hygienist. She would be the one that would be seeing you on a regular basis for normal maintenance procedures. She's just a wonderful person. She's always has an upbeat attitude. And what's unique about her is that she's always going to ask you how you would like her to treat you. She's not going to assume that she knows what's best for you. She's really going to listen to you. And that's something we all pride ourselves on very much. That's me, Steven Greenman. That's my daughter, Nicole, and my wife, Lenore, Nori the dog. I'm local. I was born and raised nearby. I went to high school in the Valley at Birmingham High School. College was at UC San Diego, graduated in '77, and I went immediately into UCLA School of Dentistry. I graduated in 1981. I've been involved treating dental implant procedures now since 1988. We've lost track a long time ago of how many procedures I've been involved in or have done as well, but literally into the thousands. And, we've been off a lot because of the COVID. So I've been really into bicycling, hiking over the summer, body surfing. We're cooking at home, so I'm really into that and reading, et cetera. But what I'm really passionate about is professional continuing education. And I've really re-energized myself by becoming certified in some pretty advanced dental implant procedures that I hope to be able to tell you about. So, I would like to hear, why you are here. Maybe we can hear from some of you that might be in the audience. Here's a picture of what we call a full arch case. This is a fixed permanent bridge that's fastened to dental implants. And I believe this gentleman might even be, in the room, but if anybody would like to say a few words, now would be a great time. Just unmute yourself and chime in.
Yeah, good evening, Dr. Greenman. My name is Lyle, and I've known your family many, many years. Right now, the formatting on the screen is slightly askew to the left, and so the picture on the left side of your screen, most of which is lost. So we're only seeing the right side of the screen.
Is that true for everybody?
No, I see both pictures.
Excellent.
And I see nothing.
I see both pictures as well.
I hear nothing, I see nothing, I know nothing.
I see both pictures.
This clearly is an ID 10T issue, and I shall
I see
own
both as well.
formatting.
Can you hear me?
Anybody else having any issues?
Can anybody hear me?
No,
I'm talking.
Okay, I believe I may have resolved the issue in my own
They
instance.
can't hear me.
If I
Can
can't
you hear
hear
me?
you, it means that you're muted. So please unmute yourself if you can't hear me. There should be a little mute button on the corner. I see now, Carolyn, you just unmuted.
Yes, I did.
So yeah, Carolyn, tell us a little bit about your situation, Carolyn.
I'm so happy. I have teeth again. I came to Dr. Greenman's office about a year ago from New York. I moved to LA from New York in January of 2020. And I saw Dr. Greenman for a consultation. I had been missing three teeth, and I was very unhappy with the gaps. And he explained the whole procedure to me, how it would take time to get organized, so to speak, in terms of implants. It's not an overnight procedure. It takes time to get fitted. It takes time to do the implant work. It takes time to get the crowns and so on and so forth. So I recently finished almost a year later, but it was well worth it because in the interim, I wasn't able to chew properly. I was very discouraged, and the way it looked was awful. So now I go around flashing my smile again, and I'm very, very happy. I think the main thing I'd like to say is when you walk into Dr. Greenman's office, not only is the staff friendly and warm, which is lovely, but there's a strict sense of professionalism about every staff member, especially Dr. Greenman, of course, but the sense you have as a patient is one of complete confidence that you're being treated by professional people who know what they're doing and who use the utmost concern in terms of your comfort as well as your progress with the whole process. So I had a tremendously positive experience thanks to my son who referred me to Dr. Greenman in the first place. Got a great referral from him. And so I decided, to go with that. And I'm very glad I did. Very happy.
Well, thank you. Now, Carolyn's case, every case is a little bit different. Carolyn, I think it's okay for me to tell that you are missing back teeth on the bottom. And those teeth are the teeth that are going to bear the heaviest chewing forces. And so because of your situation, it did not lend itself to putting in immediate teeth on top of the implants. The implants were very stable. However, protocol called for waiting a minimum of 45 days after they were placed. And then, of course, just the scheduling and all of that, that's why things take as long as they did. But I'm happy we got a very nice result, and you can hear Carolyn's really chewing well and doing just great. So, I want to kind of move on and get into the topics that we're going to cover. We want to I want to educate the people who are on this call. I want you to know what a dental implant is. And I want to also talk about why we do dental implants. So, why does tooth loss equal bone loss? What is it about the jawbone? And why do we need dental implants to replace missing teeth? Dental implants versus removable or fixed bridge work, okay? Why would you want to pick a dental implant over something like that? Let me see if I need to mute somebody, mute her, okay. So, and then I also want to cover why dentures do get loose over time. And we want to talk about, full arch dental implants. I'm sorry, is that Niall, were you asking something? Okay. So, why do dentures become loose over time? I also want to discuss full arch dental implants supporting removable and fixed bridge work so you can know what the differences are. And I'll touch on this teeth express method because that's how we have the capacity to do instant teeth, teeth in a day. You've probably heard about these procedures. You've probably seen advertisements on television for Clear Choice, for example. We want to talk about that technology and, of course, some before and afters. So as we move forward here, why are they such an important service? Okay, and just a few statistics, but about 36 million people, in the U.S. are completely edentulous. They have no teeth. 18 million more are missing all the teeth on one arch or another, i.e. all the upper teeth or all the lower teeth. And 120 million people lack at least one tooth. Only about 15% of the population actually uses their dentures. They can't eat with them because they're loose, they're uncomfortable, they hurt. They rub sores on the gums, etc. We make in the United States a little over 2 million implant-supported crowns. So most of the people who are missing teeth don't get them replaced. And my job is to talk about why that's probably not such a good idea. Wearing dentures can reduce our life expectancy. And the reason for that is that without tooth roots, in the jawbone, the underlying bone begins to dissolve away. Without that stimulation of teeth, the atrophy of the bone sets in, and over time, the jawbone just wastes away and shrinks away, and it compromises the ability to chew. And malnutrition is a major, major factor in elderly people because their bite forces have been reduced so much. I like to talk about my grandparents. Somebody asked, well, do you need teeth? And I guess the answer is no. They lived to, beyond their life expectancy, and they raised families, and they were, successful, well-adjusted people throughout their lives. But out of the four of them, there were a total of 11 teeth, okay? And I didn't really understand this when I was a kid, but they ate differently than we did in my family. Okay, they didn't eat the same things, and when they would have to take care of my brother and I, when my parents would go away, it was unusual to say the least. They didn't eat. They wouldn't eat steaks, for example. Everything they ate was boiled. Any kind of fresh vegetables were just chopped up, almost like they'd been in a blender. I really didn't understand it at the time, but as I got into dental school, it started to dawn on me what was really going on with them. It turns out that my grandfather had all of his teeth removed right after he got back from the service in World War I, having suffered from trench mouth. And as far as the others go, I don't know all of the stories, but suffice it to say that it was crippling for them. It really was, and they couldn't enjoy life to the fullest because they just couldn't participate in the same kind of meals as everybody else did. So, what is an implant? Well, an implant is a replacement for the tooth root. Okay, it's that simple. Implants typically are made out of medical grade titanium alloys. I will tell you that not all titanium is alike, that the higher end implant companies are using superior alloys, superior manufacturing processes, and they also have superior support for dentists like me who are involved in helping our patients. So this is the difference between an implant and a natural tooth. And we work real hard to make our implants as tooth-like and natural as possible. So the crown is what it gets attached to the implant, but the implant has to go into the bone. So like Carolyn was talking about, we had to place her implants and then wait a while before we were able to move on to the next step. So, again, this is just a description of it. You have this on your handout, and I can move on. So I also want to talk about why does tooth loss equal bone loss, okay? And so, the story is this, that, again, without either teeth or implants in the jawbone, stimulating the jawbone wastes away. And this is what we see over time. We see bone loss when particularly, this would be an example of somebody wearing a removable partial denture, putting pressure on the jawbone from the external source of the denture. I'm going to put a highlighter on right now. And from that force pushing down on the denture, let's change colors. Red. We see this dissolving away of the jawbone, and we see this all the time. And this is what happens over a long period of time. Normal anatomy, plenty of jawbone here. You can see the teeth are lost, and it begins to shrink, and over time, this is indeed what we end up seeing. And it can get to the point where a person can no longer wear a denture and also have a compromised bone support even for dental implants. So why do we need dental implants? Well, tooth loss without replacement, we covered this, it equals bone loss. Denture wearing can accelerate the bone loss. And I also want to talk about bite forces, a little bit about the physics of bite forces, but we are able to bite, if we have our own teeth, on our first molars, so 6-year molars, with up to 250 pounds per square inch of pressure. That means we can chew up, most anything that's normal for us to eat. However, bite forces get dramatically reduced in denture wearers, okay? 75% in the first 5 years. And after 15 years, it can be down as to 97%. So here's the numbers. Natural teeth, 150 to 250 pounds per square inch. Denture wearers, only 50 pounds per square inch. And after 15 years, many, if not most of these denture wearers are down to 5 to 10 pounds per square inch of biting force, i.e. they cannot chew normal foods. They have to eat softer foods. Therefore, as they're aging and they want to eat healthy, they can't eat the fresh fruits and vegetables that are really vital for us to maintain good health. But with implant supported teeth that are fastened in, that are fixed in the mouth, biting forces do get restored virtually to 100% of normal. It's quite remarkable that in our patients who do get teeth in a day using the Teeth Express method or all on 4 or some of the other methods that we do, within a couple of days they're able to eat anything again, and it's just remarkable the change that they experience because of this. Dental implants versus fixed or permanent removable bridge work, because many people will ask me, well, based on cost, is a bridge going to be less than a dental implant? Well, the actual cost, raw cost of a dental implant, single dental implant versus a 3-tooth bridge is about the same, okay? One issue is with dental insurance plans, sometimes won't cover the dental implant option, but I got to assure you that over time, the dental implant option is going to be the most economical and work the best. I mean, this is what we have to do to teeth in order to do bridge work. In order to replace this one single tooth right here, we have to chop down the teeth on either side like they've been in a pencil sharpener. And I've always hated to do this. I always thought it was, screwing up teeth really, really bad to make something better. And it just didn't make sense. And so we developed all sorts of other workarounds to try to make it work without having to do this. None of those worked, particularly well. But with dental implants, as you can see in this picture, she's got a beautiful smile, beautiful teeth. She just happened to be missing congenitally those 2 teeth. And then that's common. I'll show you an example of one of our patients. And instead of having to do what you see here on the left, we had 2 dental implants, attached teeth, and you can see the outcome is so beautiful. Why do dentures become loose over time? Well, what happens is the pressure from the denture that causes shrinkage of the gums and the bone, and they become loose. They become loose typically within 6 to 12 months of being made, or even after a reline, and that gap appears. My grandfather that had the trench mouth, he used to do a parlor trick. Every time he'd eat, he'd run his tongue underneath his denture, and somehow the upper teeth would come up like floating in his mouth. I never could figure out how he did that. I tried to do it in the mirror. I couldn't figure it out until much later when I realized that, that's what he was doing, was cleaning underneath his denture with his tongue. And this is what he looked like, and this isn't his picture, but his was even worse. And the long-term denture use results in this shrinkage that you see here. So we'll talk a little bit about, full arch dental implants, supporting removable versus fixed bridge work. And I want to show this right here. So this is a typical option. These are called locator abutments. And oftentimes a person will get 2 implants like you see here. And these are like snaps, like a pair of jeans, or a cowboy shirt. And there's a little corresponding snap up in the denture, and it goes down on top of this, and it snaps into place. Now, and that will help to hold the lower denture in place. Certainly will help to preserve the jawbone where the dental implants are. There will be still some movement back and forth, and this has to be removed in order to clean. On the right here, you can see what a permanently attached bridge would look like and how it can be fastened on as few as 4 dental implants that are angled in a particular way to take advantage of the best volume and secure bone that the person has. This on the right is an example of the Teeth Express method, where we can literally attach permanent teeth at the same time as the dental implants go in. So it's about can be anywhere from a 2.5 to 4 hour process to do this. And the outcome, as you can see, is permanent teeth. So the Teeth Express method, full arch, full mouth dental implant procedure. It makes it possible to receive a complete set of really, really great looking teeth in as few as a few short hours. The dental implants are placed, and then the fixed bridge work is placed at that appointment. So we collect quite a few records, impressions, and home beam CT scans. And then we have all the parts and pieces manufactured in advance, so that when a person comes into the office, we have everything we need to be able to send them out with permanent teeth. It does, it is a complete life changer for everybody who gets this. I often get, and we'll answer some questions about dental implants and some specific questions that you might have going forward. I did promise to show some before and after pictures. This is an example of one of my patients, and here you can see he's in high school over here on the right. This is before he gets dental implants and porcelain veneers. He's missing this tooth right here congenitally. You can see how this tooth next to it is somewhat malformed and not symmetrical, and this tooth is of an unusual shape. And then here he is afterwards, with dental implants and some porcelain veneers on the 4 front teeth. Pratt is now a physician. He went to UC Berkeley, and then from there he went to medical school at UCLA. He's finished with his residency. His family owns a pharmacy. I'm not sure if they still own it here in Westlake Village. Another one of our patients, this is Vicky. She came to me because she was missing these lateral incisors. I actually had her go and get orthodontics done in order, because the spaces were not adequate for me to be able to put the dental implants in. But she had braces done, and then we did this restoration. I gotta say, this restoration is well over 20 years old, and she's had no problems with it all of that time. This is another example of the teeth in a day method. This was called the all-on-4 technique. This is 7 days post-op, and these are temporary, but fastened, fixed, permanently attached. But the first step is to get temporary bridge work like you see here, and then after an appropriate healing period of about 3 to 6 months, that gets converted into a permanent situation that is reinforced with various materials so that it won't break going forward. So just a few common questions and answers that I want to go over. I don't want to keep you, for a long period of time. I want to throw this open to some discussion that people may have. But first of all, are dental implants safe? Yes, the answer is yes. We've been doing dental implants, titanium dental implants now in dentistry for 60 years with a great track record, and it's been very safe. They do not cause damage to the bone. They are, these materials don't decay. They are the same type of medical grade materials that are used in, bone fixation. I'm going to minimize this. And are something that I wouldn't hesitate to get myself. As a matter of fact, I did get a dental implant on the bottom left here over the summer, at the end of the summer, because one of my teeth that had a root canal and a crown that was done about 35 years ago, the tooth finally broke. The root split. I knew it was split. I could tell by the symptoms. And I then had the tooth removed and dental implant placed, and I have the crown in place now. So as far as, would I get dental implants? Yes, in a heartbeat. I did dental implants for my mother-in-law, for my father-in-law, for my own father. My wife has a dental implant. So there's nobody that I would hesitate to do it for. Even my sister-in-law, I've given a dental implant to. Risks associated with dental implant surgery. Well, there are risks with any kind of surgical procedure. Typically, the complications are not serious. They're mainly mild. They don't really require too much treatment, but some pain, swelling, bleeding, chance of infection, all of these are potential problems that can occur. Other questions, what are the side effects with dental implant surgery? And again, I kind of covered that just a minute ago. Pain, swelling, bleeding, being the main factors that we see. Does it always work? Okay, I mean, can it fail? Well, anything can fail, but dental implant surgery has a 95% success rate. And if the bone doesn't fuse to the implant, oh, somebody got out, we'll let her back in. If the bone doesn't fuse to the implant, well, it'll have to be removed and repeated. And typically, if an implant is going to fail, it's going to fail within the first days to weeks of placement. So then what we would do, we'll remove the dental implant, we'll allow for some soft tissue healing, and then replace it. Knock wood, whenever we've had a failure, and again, 5% is a significant number, but this second placement, we've always had success. We've never had a problem with second placement. So things that our patients need to do is, take care of themselves. They need to maintain good oral hygiene. They need to avoid biting on the area that has the dental implant, and a few other warning and protocols that we will hand out to our patients. And then, of course, follow-up from us is very important too. Can the success rates be improved? Well, again, how do we improve success rates? Well, the quality of the dental implant, I alluded to that earlier. Also, I'll tell you, the training experience of not just the dentist, the entire dental team, aseptic practices, proper care, and case planning, that's a very important factor. And also nowadays we can use guided surgical methods, which take any of the chances of placing the implant improperly or at an angle that's not favorable, because we now can create precise guides that allow us to put the implant exactly where we intend to do so. How do we do guided surgery? Well, it involves getting digital scans of the teeth, okay, instead of the GUI impressions, digital scans, and cone beam CT scans. And software nowadays can merge those scans together in order to then create a guide. And you can see it here in white. This is the guide. It snaps on the teeth. This is a case that we did not last week, but the week before. You can see it's a lower first molar. This would not be a tooth that we would attach a crown to immediately. We would allow this to heal for a period of time. I did all the surgery virtually using the software, and then we had the guide to help us to place the implant precisely. Here's another example of a guided full arch case. This is actually the same case as the last person that I showed you that had lost his upper teeth and then he had temporaries. And this is his guide. You can see down here on the lower right corner, this is the actual guide, the virtual guide in place. And his surgery was done in a guided fashion as well. So, hope I didn't bore you completely. I do want to offer consultation and examination appointments to all attendees, and certainly I welcome you sharing this with friends, family, anybody that may benefit from dental implant therapy. I'm offering a no-charge consultation. We can discuss in private, your situation and the concerns you have. After that, should you decide to move forward, we'll schedule for all of the record making so that we can do the full examination and do the case planning that I talked about just previously. We'll give you some options, and based on what we find, coupled with your desires that we've elicited by talking to you and asking questions, we'll figure out a plan that works for you, that works for your budget, and that's affordable. Okay, this is an affordable procedure, and we have the financing in place, et cetera, to help you to that you can get what you need, what you want done with us in total comfort, in our office. So that follow-up appointment takes about an hour. That would be the initial, after the consultation, there would be the examination, and we would then obtain all of the rest of the records that we need to perform the case. So how do you get in touch with us? Well, all of you have received a personal email from me, and my contact information is in that email. I also am going to send out another one to the participants here that have actually come to the meeting, and I'm going to send you, it's a SurveyMonkey link, and I'd love to get some feedback. It's totally anonymous, and I want to know what you thought of the talk so that I can improve it. My telephone number, as you see, 805-496-9555. You can just put in Steven Greenman, DDS, and you'll find me, right away on Google, or you can go directly to our website to get more information. It's www.drgreenman.com. So with that, I think I'm going to escape out of here and go back face to face. So. Okay, so I'm going to try to get rid of all this. Give me a moment. Okay. Okay, so I do want to throw it open to questions and try to unmute everybody. Doing my best. So go ahead, you can control your own mute button. If you do have any questions, please ask them now.
I have a question. It's Ramona.
Hi, Ramona.
Hi. From a time frame, what is this? What is the procedure that way? How long does it all take?
Okay, from the time that the implant goes in, typically there is a wait period that's going to be a minimum of 45 days. I like to typically go about 3 months, and it depends on what the site where the implant went. So is it okay if I talk about your specifics?
Sure.
Okay, so Ramona had a fractured tooth, and we had to remove it. It was not an easy tooth to remove because it had broken into many little pieces. It had a root canal. She's finally healing up from the tooth removal, but we've got to wait now for the bone to heal and to fill in and the soft tissue to heal properly. And typically that's going to require approximately 90 days before we're ready to consider moving forward. Everybody's going to be a little bit different, but we'll follow Ramona along to make sure that she's healed adequately before we move on to the dental implant. I think the first guided case I showed you was a very similar case to yours, Ramona. It's the exact same tooth position in the mouth, very similar situation. I believe that we went, I think in that particular case with Christiana, I think she waited. She just wasn't ready to move forward, and I think she ended up waiting well over a year. But that's fine. I mean, time is kind of our friend because the bone heals. So in your case, minimum of 3 months before we would put the implant in, and then you're probably another 3 months down the road before you get the permanent tooth.
Okay.
Okay. Any other questions?
Yes, I have two questions. Robert,
Certainly. Yeah, I'm listening.
Oh, I'm sorry. If you would do the procedure that the Teeth Express are all on for the 1-day procedure,
Yes.
how do you pull all the teeth out in that same day? How does that work?
Okay, that's a great question. Well, typically on a procedure like that, and I can go back to that the slides that I had and show you, but let me open up my slides again. Okay, where is it? Okay, so I think you can see my screen again, and I'm just going to go down to, and it will typically, yes, we would like this particular case here that you see right here on the screen. We got all of our beginning records, and here we go. And he can see here that he had remaining 1, 2, 3, 4, 5, 6, 7, 8, 9 teeth. And yes, at the time the implants or the teeth are removed, the implants are placed and the bridge work is attached. So the answer is yes, we would remove teeth at the same time. You do not have to go without teeth and let everything heal in order to have this procedure done. As a matter of fact, most of the people that we treat have teeth to be removed at the time that we do the implants and the permanent bridge work.
Okay, so I just want to be clear here. So let's say we're looking at the upper here.
Yes.
You removed all of those teeth and then put these implants in,
Yes.
and then you attach the bridge work to that all in the same day.
Yes.
Okay. And then my next question is, if you only have, say, for example, 4 implants put in the jawbone, how does that preserve the bone from not shrinking because you've taken out so many other roots within that bone?
Okay, it will preserve the jawbone exactly where it is. So the teeth will come out, and typically then the implants will go in essentially where the teeth were, and the jawbone then where the implants are is preserved. Also, anywhere else, there's no pressure on the jawbone because the permanent bridge does not put pressure on the gums themselves. So the stability is superb with these sorts of procedures. And you can see this is a case where we actually used 6 dental implants.
Right.
Certainly, would love to, go over your particulars, with me, like I said, at a no charge consultation. I'd be happy to, set something like that up for you.
Okay, I think I'd be interested in talking to you about that.
Sure. Yeah, but those are all great questions. But that's how remarkable this particular procedure is. And and how well it can work, provided that it's planned out properly.
Well, thank
I
you
have a
for answering the
question. Sorry.
Sure.
Hi, I'm Donna. Can you hear me okay?
Yeah, I can hear.
Terrific. I have a question, following up on his question about when you, let's say you pull, the teeth, you pull them out, and you're only going to put 4 or 6 implants in. So I understand the part about preserving the bone where the 6 screws go in, but the rest of the gums, it doesn't start to decay around it. Just basically, is it the denture that causes the decay then? Because if you're not wearing a denture, then the rest of your mouth is preserved.
The bone loss will be mitigated if you're not wearing a denture, pressing on the jawbone itself. It's a combination of no teeth and the denture that causes most of the bone loss. Although a certain amount will occur no matter what. But usually in these particular cases where we're putting in and removing all of the teeth are no longer viable. They're no longer able to be restored with any kind of predictability. So this is an option for folks that, like I said, and there's a huge population of people who are missing all of their teeth, or missing all of the teeth on one arch or another, or have teeth that are so far advanced with tooth decay and gum disease and what have you, that they just can no longer be saved.
Thank you. My teeth, if you pull the teeth and you want to do all on one same day, what if you need a preparation? Did I understand someone once explained that there's a required prep, either a buildup of a bone, or what if something like that is required?
All right. Well, the beauty of this full arch method that we're talking about is that it avoids bone grafting. And I think what you're alluding to is,
yes,
is bone grafting to replace missing bone, or to stimulate the body to grow bone where there is none.
yes.
This particular, and so one of the challenges that we've had is that there would be inadequate bone in the back of the mouth. The main nerve and blood supply would be close to the surface of the bone, and not enough bone to really place a robust dental implant in without risking damage to that nerve and blood supply. Conversely, on the upper jaw, once the back teeth are lost, the sinuses begin to enlarge. We call that pneumatization of the sinuses, and so having to do bone grafting to augment bone within the sinuses is also done. But because of this technology and being able to angulate the implants, we've been able to mitigate that. If you'd like, I can show you a little video on that if anybody wants to see it. Let me see if I can get it up. Okay.
Thank you.
As long as you can see my screen, I think I can show you.
Terrific. Thank you. Yes, I've been told my sinuses need to be lifted.
Okay, yeah. Let me see if I remember my login. Okay.
I never remember mine.
Yeah, I may have to go in the other room and get my my Rolodex out to get my login. Okay. All right. Okay.
I have teenagers to remember.
Doctor, you still use a Rolodex?
I use the Rolodex for passwords and usernames because it's totally secure. I mean, nobody from Georgia, I'm talking about Georgia, near Russia, is going to be able to come into my office and get my passwords that way. So yeah, I think writing, and at home I write them in like an old-fashioned phone book. That's how I do it. So Donna, do you want to see it on the top or the bottom? Which would be more appropriate for you?
The top first, but I'm actually going to need both top and bottom
Okay.
full arch.
All right. Okay.
Dr. Greenman, I'm going to have to exit now. I'm sorry.
No, it's
I've got
okay,
some-
Ramona. I know
Okay.
you got some. You've got to listen to a concert on television, so go for it. Okay.
Awesome.
Okay.
Thank
All
you
right,
very
bye.
much. All right, bye.
Okay. So
Bye.
hopefully, I think the audio should. If the audio is no good, I'll play it again and narrate. How's that?
Thank you.
Now what they're showing there is the sinus. This is the sinus cavity that they're showing.
Okay. Oh, it's angled.
Yes, it's angled for this type. Now there are other options as well.
I see. And my sinuses are right up here. They're bigger.
Right. So this obviates or eliminates the need for bone grafting. Okay, and that and this is not new technology, by the way. I mean, it's improved and advanced technology. However, it has been with us now for getting close to 20 years. Okay,
Right.
and there are other ways to do this with multiple implants. But again, we do multiple implants. We can do multiple implants on individual teeth. But then that may be a situation where you have no choice but to go into some sort of bone graft.
Right.
We're very happy that we have this other option for our patients. So let me see if I can go back and I'll show you the lower. And here's the lower.
A quick question. I saw a lot of gaps in that video when the teeth were mounted.
Yes.
What happens in those gaps? I mean, how do you clean those, and what's with that?
Well, the gap, I mean, the gaps you have to be able to clean underneath, okay? And these are designed in a way where you can use a water pick, and you can also use dental floss. We also like to use yarn. I'll show you on this particular one, and I'll stop it at that point for you. That must be Robert. Was that Robert?
Yes, it was.
Okay.
Wow. Looks painful.
Now, this is that nerve that I was talking about. There's nerve and blood vessel, and this is a vital structure. If we damage it, you can be permanently numb. So we have to
Great.
avoid it.
Wow.
And you can see there's no room to put implants in the back.
Right.
Yeah, it would penetrate that nerve, and we can't do that.
Mm.
And then you'll see the prosthesis going on, and then I'll answer the question about cleaning. And you can see the prosthesis is retained by screws, which means that okay, so yes, there is a space underneath. These bridges held entirely in place by the dental implant. But what one does is cleans underneath with a water pick is a good way, rinsing. And then we also like you to use either dental floss or actually using yarn, okay? That you can then clean around the implant posts. Every year, I want you to be in the office so that I can remove the prosthesis. I unscrew it, we check it for make sure that it's intact, that there's nothing that needs to be maintained on it. It also gives us a little better access to clean around the implants and then put it back. So that might be a year, maybe every 18 months, but we want to see you regularly in our office for ongoing maintenance. That's an important part. And they're easy to clean, and they don't accumulate, tremendous amounts of food. Certainly nothing like a denture or a partial that lifts up and down.
Okay, thank
Okay.
you. for that.
Thank you. No, that's a good question. Does it show? The space doesn't show when you smile and talk, correct?
Okay, that again, that's a critical part of the planning. You're asking great questions. When we plan these uppers, let's see if I have it. I'm gonna skip to the end here. See if I can get this to go to the end, and then I'll pause it.
A lot of space.
Okay, so I'm going to pause it here. You're right. I mean, this junction right here cannot show when you smile, and that's an aspect of planning. Part of our planning is a very carefully obtained set of photographs. So that in measurements, so that we know that juncture cannot show. Okay, and so we've knock wood, never made that mistake, but I suppose it could be made without proper planning.
Okay, so it's just a matter of position.
Yes.
Thank you.
No, you're welcome. Thank you, Donna.
Then I have one last question at the moment.
Sure.
If you have existing implants already, are you able to use those, or do they have to be removed and a new set have to be placed?
Well, that depends. If you've got some implants that are well positioned and are well integrated to the bone, then I might try to use them. Okay, I've got one of my cases that I did several years ago. We did maintain the implants. There have been others where they have just not been well anchored and they've had bone loss, and so we've removed them. So again, that is an individual call, and that's part of the planning process that we do.
Thank you.
Sure.
Terrific. Do they hurt, the physical implants? I mean, do they inflame? Do people come in with trouble? Do they get blisters? Like the teeth that are in there that need to be pulled, sometimes they blister and they hurt.
Okay.
Does it become part of your bone? Is that what it is?
Yes, the implants become integrated with the bone. The jawbone grows around the implant, and the implant just becomes integrated with the bone. Do they hurt? Well, it's a surgical procedure, so you're going to have surgical wounds. If you've had teeth extracted, you're going to have some pain where the extractions were done. But remarkably, you'll be able to bite with some degree of pressure right away with your implant supported bridge work without pain. Unlike in the old days when we would take out the teeth and put a denture right on top. And that was very painful, because now we're putting a denture onto a surgical wound. Okay, so that was pretty miserable. Did we do them? Yeah, that was all we had. Back when I was in dental school in the 70s, we were doing that, and we were taught how to do that. But dentures really have not changed in over 100 years. Okay, fortunately, we stopped making them like George Washington's, where a wood carver carved them out of wood, and he was miserable. But they've been made out of plastic and artificial teeth now for well over 100 years. The technology has not changed. I mean, think about driving a car, a modern car compared to a car that's 40, 50 years old. Well, it might be an antique that you love, but there's a world of difference.
Right. Okay. No, this is very informative. It kind of alleviated several fears that I've had, and I'm going to be looking forward to making an appointment with you.
Oh, well, thank you. No, I'm really here to educate. I love teaching. this isn't the only thing that I do teach. But you know, to have this opportunity, you know, with all of you, I do thank you for joining me. I'd love to talk to anybody who'd like to individually. I'm going to expect another email. It's not going to happen tonight. I got to go home. But tomorrow, you know, or over the weekend, you know, or the next few days, I will get a personal email out to all attendees. So you can look forward to that as well.
Thank you so much. Appreciate it. Appreciate everything. I'll meet you soon.
Okay.
Did you send in the prices on that, or is that something we talk about at the consultation?
Yeah, come on in for the consultation. We'll go over, you know, costs and, you know, and we'll go over how it's paid for. And we've got some exciting options available that can, you know, can really make this work for you. So yeah, I'd love to come in, you know, and talk about all of that kind of stuff in private. Yeah, please. Okay.
Terrific. Absolutely. Thank you for your time. Much appreciated.
Okay. Okay. All right. Well, with that, if there's nothing else, I'm going to stop the share. Here I am.
Well, thank you, Doctor.
Thank you,
Yeah.
Doctor.
Thank you.
Thank you. Good night, everybody.